Hello, friends. This is a special episode on the big news, the vaccine for the COVID 19 in the United States and across the world. And we're going to witness a person, a doctor called Kishore Challa, who have taken the vaccine, who's the first person in the state of West Virginia. And he's going to talk about what are the implications of the vaccine and, how it is going to revolutionize our new normal.
Namaste to everybody. My name is Dr. Kishore Challa. I'm an interventional cardiologist and chief of cardiology and director of the cardiac cath lab at Thomas Health Systems in Charleston, West Virginia. And I also have the distinction to be the chairman and president of the West Virginia Board of Medicine, which has about 8,000 MDs and 1,000 physicians under our jurisdiction. I've been practicing cardiology for the last 32 years in this state, in this hospital. And I see patients in the emergency room, patients in the hospital, on the COVID floor, ICU, and people who are very, very sick.
And so, Doctor, my audience is enthusiastic to know about this fact. Tell us about the quarantine for the last 10 months and how you monitored different cases and what are your observations?
As all of us know, for the last 10 plus months, this COVID pandemic has shattered the whole world. And initially, people were refusing to admit it. But after 20 plus million people infected and almost a million people dying of it, and so much of mortality and morbidity, it's about time the whole world opened their eyes. And initially, and even now, one of the best ways to limit any infectious process is quarantine. Unfortunately, the world did not agree with it. Initially, European countries quarantined people, and United States had a lockdown for about 1 month, sometime in March. At that time, with me because I had the board of medicine and the distinction being the president, what we did was one of the things which can spread this virus is overcrowding. And especially in doctors' offices, the patients sit next to each other and wait for sometimes hours to see the doctor or have their tests. So one of the things all the physicians were recommended that the number of chairs in the waiting room be reduced by more than 50%, and there should be at least 6 feet between any patient, and hand washing and all the precautions were taken. One epic thing which we could achieve for the whole country was telemedicine, where we could achieve a telemedicine bill where patients can be seen on Skype, FaceTime, or a Zoom, and can be taken care of that. And that really helped the whole country because the doctor's offices did not get shut down, and they got the same kind of payments from most of the insurance companies. And this quarantine, I should salute certain countries, especially Australia and New Zealand, who really followed this quarantine. That's why their numbers are in single digits. Like in Sydney, for example, if there are 5 COVID patients on a day, that's big news. Whereas most of the world really did not follow it in the strict quarantine fashion. Okay. Now, a brief input about any infectious disease. Okay. The way to prevent spread of the infectious disease like coronavirus is called get a herd immunity. What is herd immunity? I'll tell you, I mean, the world has so many billions of population. What is herd immunity? I'll give you a simple example. Let's say there's 100 people in the community. Okay? If there are 100 people in the community, if 50% of them have antibodies to the virus, that is a majority of the people have the antibodies to the virus. And how do you get the antibodies? One is when you get infection, you get the antibodies. Second thing is if you get a vaccine, you develop antibodies. And I just gave you an example of 50%, but every infectious disease has their own, depending upon how infectious that is. For example, on measles, that is one of the most infectious disease known to man. The herd immunity in there, you need to have 95% of the people to get the virus or the vaccine so that they don't spread. Nobody knows the COVID numbers yet. So that's why you don't want more than half the population to get COVID. That's why this vaccination has been a really groundbreaking event in the history of medicine. For any vaccine to come out, there's several phases, several things before the vaccine comes out. And on an average, a vaccine takes about 10 years plus to be developed by anybody. Really, within less than 1 year, we already have one vaccine approved, which is Pfizer BNT 164 messenger RNA vaccine. And just about half an hour ago, the FDA approved the Moderna mRNA 1273 messenger RNA vaccine. These two vaccines are to be given in 2 doses. I was the first one to get the dose in our state. And I wanted to make a point there. You have to follow the example. Whenever you tell the patient to take a vaccine, his first question is, did you take the vaccine? If your answer is no, then he would say, why are you asking me to? So that's why I was one of the first one to volunteer taking the vaccine so that it will be an example for the patients and the general public. And this quarantine is important, even though we should not get the false sense of security that there's a vaccine and I got a vaccine today, I walk out, I'm immune. No, it doesn't work that way. The two vaccines which are approved, you get the first vaccine and the second dose is after 3 weeks plus 4 days. And 2 weeks after that, you get 95% immunity. So till then, in spite of all that, the basic precautions, which we'll go through in a few minutes, is very, very important for anybody. Okay?
So, Dr. Challa, you're the first one to take the vaccine in your state. And tell us about the vaccine and how you're feeling within and what are its side effects.
As I said, I was the first person in the state to get the vaccine. And everybody asked me, how are you feeling? I feel the same the day of the vaccine, the day before the vaccine, and 1 week before the vaccine. The only thing was there was a little soreness in the arm at the vaccine site, which is probably a little more than any flu vaccine or anything. But luckily, I did not get any side effects. Now we can ask, what are the side effects of this vaccine? Okay, first thing, most important side effect is the You can divide the side effects into minor and major side effects. The minor side effects are injection site reactions and some systemic reactions, like a low-grade fever. People can have arthralgias or joint pains or muscle pains or have a little sore throat and cough. These are all self-limiting and they usually subside within 3 days. So since I got the vaccine, I have at least 400 physicians in our community who got the vaccine. And so far, we have not seen any major issues. In fact, between the Pfizer and Moderna studies, there were a total of 70,000 patients who were studied. And of the 70,000, nobody got COVID. This messenger RNA vaccine is very transient. It gets out of your system and it's not into your DNA. So there's no issue of having long-term consequences that everybody is talking about at this time. And there were only two people in the whole world with the 70%. Two of them were in Europe, where they had bad reaction to the vaccine. It's called an anaphylactic reaction, which you have breathing problems, and both of them were taken care of immediately. And when they went back and took their history, they had a lot of side effects with a lot of stuff. So that's why FDA and most of the CDC and other people put guidelines that anybody who had an anaphylactic reaction to any vaccine, be careful and don't give any COVID vaccine at this time. And so far there's no major side effects. Sometimes there was one nurse during the study who got a temperature of 103, 104, which is very, very rare. But she took a couple of Tylenols or acetaminophen, and by the next day morning, she was fine.
So the next one I want to ask you is, what is the potential of this vaccine for COVID-19 and what is its efficacy?
The potential of the vaccine is, in fact, going forward, there are several other companies which are trying to develop the vaccine. Right now, we have two of them. One is the Pfizer and the Moderna, and the other one is coming out, which is under study, is called from AstraZeneca and Oxford. There's another vaccine coming from Johnson and Johnson. The other one called Novavax company. Quite a few of these are single dose, and we don't need to go into detail how they do it. The first two ones are done by virus vectors. The other one is done by nanoparticles. And there are other vaccines from Glaxo and Sanofi also. The efficacy of the vaccine, at least these two we know, with 70,000 people, it decreased the mortality by almost 90%. Even though there were not too many deaths, the mortality was down by 90%, and the efficacy was 95%. Ironically, the older the patient, it became more efficacious. And because it is a supply and demand. And right now, there were only 1 million doses in United States. And when the Moderna, which just went through FDA, which will be approved in the next day or two, they have about 5 million more doses. So how to triage, who to get? The initial people who got are the frontline workers. What are the frontline workers? People who take care of patients in the hospital, where patients are admitted with COVID, where the patients are admitted with COVID-like symptoms. And these are the frontline workers. It does not have to be just a doctor. It could be a nurse practitioner, transporting person, the ER personnel. So these are the frontline workers in the phase one. These are the ones who are getting the vaccine. And the second is people who are sick in the nursing home. Unlike India, the nursing home here is adult homes. And if these are the two people, and the phase two will be rolling out very soon. where they have to triage who to get first. And that's about the vaccine and the efficacy. More important is, as we talk about the herd immunity before, once you get the vaccine and 2 weeks after you get the vaccine, you get antibodies. So that will help the herd immunity. And that way, Sweden was one of the first countries who really banged on the herd immunity. And they basically are much better than most of the European countries.
What will be your take for the vaccine in the world?
I think there are about 90 vaccines coming out. And thanks to Indian government, that they are also making vaccines for millions and millions of people. And obviously, they are all going to be tested. And the way I tell you, the way I tell everybody is don't be afraid of the vaccine, be afraid of the virus. This virus, anything in medicine, is a risk benefit analysis. If there's the risk of taking a vaccine is more than the benefit, then nobody is going to recommend the vaccine or any medication. At this point, the risk of not taking the vaccine when it's available is very, very high. Let it be whatever the vaccine. I think all the vaccines are studied very hard. Where most of the governments have spent millions and millions of dollars. Now I can't even say millions, billions of dollars. And once it is available, I would not hesitate recommending to anybody. That was the first. That's the main reason I was the first person to volunteer and take it, because you have to prove a point. I can't say that, oh, I will wait for somebody to take it. Then nobody will take it. So this vaccination has been a really turning point, and hopefully by spring and summer of next year, there will be enough vaccines available, enough patients the vaccine is given, so that the world travel, the world economy, and more important than all that, the number of people dying and getting infected with the COVID virus will be much decreased.
So, Dr. Challa, you have witnessed so many thousands of cases in these last 1 year. So, tell us what are your precautions and measures to all our viewers?
The next point I would say is the precautions and the measures as a doctor, what we recommend for everybody. Most important, if you see somebody, you have to assume that he has symptomatic or asymptomatic COVID, except in the immediate family. If you're seeing anybody outside the family, using a mask is very important, is very, very important. Hand sanitizing the hands is very important. And just be careful. I mean, if you're coughing, cover your mouth, and try not to wipe your nose or your mouth with anything except a soft tissue. The best thing to do for washing the hands is warm hot water with soap for 20 seconds. And till all this is done, crowding in the public places, going out in public places, everything should be avoided. That's where this spread is. Right now, we are seeing a second surge in the United States. And there was no doubt in anybody's mind, especially Dr. Anthony Fauci, who is the CDC director, because people slacked during the Thanksgiving holidays of 4 days, and there was a lot of mingling among people. Now we are seeing almost 1 million cases a week in the United States. So these precautions to everybody should continue going forward. Obviously, just do whatever is 100% essential. Otherwise, do not mingle except for the immediate family. For example, even when we went out to see my son or daughter, we stayed 6 feet away from them. In fact, I had the privilege of getting a COVID test 1 week before, and my son also had the COVID test. And we did not sit down on one table next to each other at all.
Thank you so much about sharing your insights about the vaccine and its implications. So, share your final words and your closing message to our audience of Mana TV.
In summary, what I would say is all of us need to be careful, all of us need to be safe. We do not have to hesitate when the vaccine is available, especially it is approved by the authorities. And we should maintain social distancing, hand washing, and the masks, and try not to overcrowd. We have to take care of our health and we need to take care of the family. Nobody expected that a pandemic like this will be coming on this world. If you ask anybody 1 year ago, this reminds more of the plague than anything else. And I want to say namaste to Mana TV viewers and మీ అందరికీ good luck. Thank you very much.
మన టీవీ ఇంటర్నేషనల్ అని చెప్పండి.
I would say thank you to Mana TV international viewers. మీ అందరికీ good luck చెప్తాను and be safe, social distancing and mask and wash your hands. And please do not think the vaccine is going to eliminate your masks, hand sanitizers or social distancing. These are the primary precautionary measures whether you have vaccine or not. Thank you very much.